Welcome to the Doctor's Volunteer Clinic. This is a brief training video for the patient care technicians. Something we'd like to start off with is the clipboard. You're going to have one of these for every patient that you call back, and there's a little cheat sheet on the bottom of the clipboard.
Once out in the waiting room, you can call the patient by their first name. You can verify their last name once you've entered into the hallway. Be sure to ask the patient if they've been to the hospital within the last 90 days. You can take the patient back to their designated appointment room, where you can begin to check their vitals. You should have already gotten their weight in the hallway and asked them their height. The BMI will be automatically calculated in Athena. Be sure to check their blood pressure, pulse, temperature, and O2 sat. Update their pharmacy information and document any allergy information that they tell you into Athena. You can retrieve the PHQ-9 form from the patient, but be sure to write the score at the top of the progress note for the provider. Once you leave the room, circle all the abnormal values in red and leave the patient's file on the slot in the door for the provider.
Grab the cuff, you're going to find the arrow that says artery, and then you're going to put the arrow at the patient's brachial artery, which is usually just the inside of their arm. You're going to snug it tight. The patient should be seated with their legs uncrossed, sitting quietly and not talking. Turn the machine on, and then you're going to press the middle button that shows the arm with the blood pressure cuff on it. The machine will go automatically. Wait until the results are done, and then you'll write down the heart rate and the systolic blood pressure and diastolic blood pressure. This is how you're going to take a manual blood pressure if you should need to if the automatic blood pressure is unavailable. So you're going to grab the blood pressure cuff on the wall. The patient should be seated on the table. Feet should be flat, not legs crossed, and then the arm is going to be palm up on her leg. So you're going to find the artery marking on the blood pressure, and you're going to put that at the patient's brachial artery. And then you're going to want to make sure the blood pressure cuff is tight. Obviously, that wasn't tight enough. Alright, and have the patient's arm relax on their leg. Alright. The next thing you're going to do is you're going to take your stethoscope and you're going to pump up the blood pressure cuff. What you're listening for is you're listening for the heartbeat to disappear, so that's your arterial pulse. So when you pump the blood pressure cuff up high enough, you will not hear a pulse. When you start to release the pressure, you're going to hear the first heartbeat, and that's going to be your systolic blood pressure, your top number. After you continue letting air out, the heartbeat will stop, and that's your diastolic blood pressure number.
How high should you pump?
You should pump the blood pressure cuff up to about 180. That's sufficient for most patients. You're going to place the stethoscope underneath the patient's cuff. Make sure the dial is turned all the way to the right, and then you're going to start to pump the cuff up, and you'll watch the dial to make sure it goes up to 180. You're going to release the air, and you're going to listen for the first heartbeat to begin and then the heartbeat to stop. The first heartbeat, when you hear, that's the systolic blood pressure. In this patient, it was 116. And when the heartbeat ceased, which is the diastolic blood pressure, was 72. Alright, so this is the pulse oximeter. You're going to use this to get the patient's oxygen saturation levels or their heart rate as well. The heart rate is also found on the automatic blood pressure machine, which you can use to write down on the patient's chart as well. So you're going to turn it on, press this button. You're going to use the patient's index finger or middle finger, and you're just going to place their finger all the way in. Just have them relax for a minute. And the number reading should come up shortly after. So this number on the left is the patient's oxygen saturation, and right now it's 95. On the right is the patient's heart rate, which is 85. To take a patient's temperature, grab the thermometer. You're gonna put the tip down here and grab a cover, and it'll click on. You're gonna take it off and put it in the patient's ear. Hold down the button until it beeps. And you have the patient's temperature in Celsius, and you can switch it to Fahrenheit.
Okay, so this is your patient. When you walk into the room, you will click on your patient and it'll open up this screen. The first thing that you're gonna wanna click on to get into their chart is go to intake. This is where you would start to put in your reason for visit. Typically, it's harder to use the predetermined ones, so you're just gonna want to put in a note. In order to free type a note, you're gonna click on this little guy here, and that normally wouldn't be there, and you would type in their reason for a visit. So if they were here for physical, you would type in physical. And after that, we are concerned about entering in the first 4 items here on this checklist. Everything else will be gone over with the provider. So you will do 1, 2, 3, 4, reason for visit, patient preferences, vitals, and allergies. You can either click on them here or you can click next up on the top right. Patient preferences is where they like to go and get their prescriptions. So you want to add in their pharmacy. If they've been here before, obviously they will have a pharmacy already stored in. If not, you will click on the plus button to add their pharmacy. And sometimes there's pre-populated ones here, or you can search for a Costco and it'll pull up all the ones within a reasonable distance, and you can just confirm with the patient which one they would like to add in. If they have multiple, like they've gone to a few different ones, it'll show up in a list here, but the one that will automatically be in their chart is going to be the one with the star right there. After that, you're gonna go and put their vitals. So after you get their vitals with the patient, then you can add in pulse, temperature, weight, height. The BMI is calculated for you, so as soon as you put in their height and their weight, it'll give you a number down here. That's how you're going to know if you need to do a glucose screening or not. And then you add in their blood pressure and their O2 saturation. After that, you're gonna go to allergies, and you're gonna add in any allergies that they have, whether it is food, medication, or environmental. And that's all.
Okay, so we're gonna do a glucose on a patient real quick, so you wanna follow me? So, for our glucose, you can see right here, it says glucose strips right there. Hematocrit test as well. Open this drawer, and everything is just set up perfectly for right there. You got your lenses, your glucose strips, your alcohol swipes, everything like that. This is our glucose test, or device. So you just pull that off. Click welcome, and then log in. The login number is right there for you. So just log in. And then you can click on glucose, accept, and then you're gonna have to scan it. Accept. The volunteer number.
And what's the volunteer number?
So you can just make one up, honestly. They're not specified. I just make a random one up. They don't really calculate it.
Okay. Okay.
And grab you a pair of gloves, which are up here in the cupboard. And then when we're pricking someone's finger, you can ask them what finger they want. Generally, it will be the middle finger, the ring finger, index finger. And you'll kind of want to do it like right here in this area. Not on the tip, not like down here, but like right in that area.
Okay, up to the side a little bit.
Mm-hmm. Yep. Okay. Alrighty. Okay, we're gonna prick you, okay? Alrighty. Okay, so we got the device in and everything. Okay, which finger do you want? Better? That one? Okay. Awesome. Alrighty. Okay. Let's see. Right in this area. I like to put a little pressure on it. Okay, here we go. Okay, so when you're doing glucose, you always want to wipe the first drop away. Okay. Sometimes you have to milk it a little bit. Awesome. Alright. I'm gonna line the blood up right with that little white dot right there, and it should suck it up. Oops. Give them something. Hold it. There you go. 85. Awesome. And then your sharps and your test strip go in the sharps container. Right down the chart, and you're done. Okay. So, is there a walk-in? They'll show up on our walk-in list, walk-in schedule right here. In green, they're ready to go, so then we'll have to write their stuff up. But if their name's under a doctor, we'll go over here, and their chart should already be pulled with all their info and stuff. So just find it. Okay. Alrighty, test. Hi. How you doing?
Good, how are you?
Doing good. I'm back. How you feeling?
I'm good.
Good. All right, we're gonna grab your weight first off. Do you want to step up here on the scale for me? Okay. And how tall are you?
5'5".
Okay. So you want to step off for me? Okay. If you want to follow me, we're gonna be right here in this room. Go ahead and take a seat. You want to follow me? So the flags tell us what we're doing. So the yellow one means that they're just going to be in here with us, the staff, and that means we're getting them ready for the doctor to see. Right, let's go. Okay, test. What are we seeing you today for?
I just have this really bad cough.
Bad cough?
Yeah.
Okay. Any like congestion really, or any like fever?
No
Anything like
fever,
that?
no.
Nothing like that? Okay. And we'll click on note. And she says she's here for a cough. Test, when did the cough start?
2 days ago.
Okay. Alright. And is the Walmart pharmacy still good for you?
Yes.
Okay. Is it the one on South Pioneer Road?
Yes.
Okay, awesome. So she has 2 here. But if you can look over here, this one is starred, which means that's one she wants to go to. And then it says here, BPOM, penicillins, Recticare, and sulfa you're all allergic to, correct?
Uh-huh.
Okay. Sounds good. Do you have any others that you know of?
Just peanuts.
Peanuts? Okay. Find this one. Alright. Okay. And now we'll grab her vitals. Alright. Do you have a preferred arm? That one? Okay. Sweet, sweet. Alright, go ahead and keep that relaxed and still for me. Okay, while it's going, I'm just gonna get your temperature, okay? I'm just gonna go in your ear. Alright. pressure's good. 113/72. Okay, so now we're just gonna add in everything. So pulse was 64, temp was 99, weight, blood pressure, and then her O2. And then there's her, it calculates the BMI already. Alrighty. Okay, are you okay if we get a glucose test on you today?
Yeah.
Is that alright?
Yeah.
Okay. Give me 1 second and I will be back with that, okay?
Perfect.
Oopsie. Okay. Alright, so we're just basically gonna prick your finger real quick and draw some blood. Okay. Alright, do you have a preferred finger? Okay. Okay, we're just gonna give you a little poke, okay? Oh, you bleed good, good. Hold on there for me. There's that for you. Do you hold that for me? Thank you. Alright, 91. All good? Yes. Okay. We will let the doctor know that you are good and ready. So when patients come in, we'll have them fill out this PHQ form. And then basically what we'll do is we'll just add up their score and then write it right here. So 1, 2, 3, 4, the rest are zeros. So we'll just add the 4 right there, circle it, and that's all we need to do. And the doctor will look at the rest, put the chart in the door. Alright, so they're all ready to go. Put the chart backwards so it's facing the door so they can have their privacy. And then if they're the next one ready to go, have the flag green and yellow. Green and yellow means that they're ready to go, and then when the doctor goes in, they'll switch it to red. But, alright.
Okay. Thanks, guys.
Okay. So, are you done? Are we done? Are we done? Done?
We could do the opening scene and we'd be done with everything.
Let's do it. What's the opening?